Good morning, everybody. Dr. Gabriel Jasper with Jeremy Vickers.
Yeah, how you doing, guys?
Painless with Dr. Jasper.
That's right.
All right. I'm an interventional pain physician, MD, board certified. And today we're going to talk about some stuff that's probably going to be redundant, but I like to emphasize certain points all the time. In other words, number one, what does an interventional pain physician do? We get rid of the pain generator. And you can have so many pain generators, and we talk about this every time. And you can't compare what we know today compared to what we knew yesterday,
Right.
years ago.
Yeah.
We used to give just one epidural, and that was about it.
Mm.
And then I was giving epidurals to people 20 years ago, and I give one epidural, two epidurals, and they do great. And they come to my office 20 years later and say, "What, were you better in those days? How come it worked then and it doesn't work now?" Because you're older. You're 20 years older.
Right.
And as you get older, things don't work.
Yeah.
Why? Because all of a sudden you got a hell of a lot more pain generators than you did when you were, 30 years old, 20 years old, 40 years old.
Your
When
body's
you're 60, 70, you got at least 5, 10 different pain generators.
Yeah.
And what's tricky about it is that a lot of them give the same kind of pain. So you got to figure it out.
Yeah.
I mean, if you got somebody who's got, his back goes out, you got muscle spasms, maybe they got, a little pinched nerve, but nothing terrible, or they got arthritis, and they got all kinds of little stuff going on because they're an athlete, whatever it is, and they come to you, and they're young, and you give them an epidural, they all do great.
Right.
They feel like $1 million because what's happening is you get an epidural, and it goes in to the general area of spine. It bathes all the nerves there. It bathes all the local arthritis in that area. Any kind of inflammation in that area bombards it's like a hand grenade. And then some of it leaks into the bloodstream. And I've had people say, my epidural, my thumb doesn't hurt anymore. A lumbar epidural, it's not supposed to happen, but it does. Why? Because the steroid that you give goes through the bloodstream and it covers every single cell in your body.
Right.
Not to the extreme that somebody would get when they give them, oral antibiotics or intravenous antibiotics. That's a major dose, which we try to avoid most of the time. Certain doctors can't avoid it because that's all they know how to do. They don't know how to specifically hone in on certain pain generators.
Right.
And this goes on to talk about patience. People come back and say, like I just said, 20 years ago, you gave me a shot. Now it doesn't work. So they already got kind of a bad attitude. It's a common sense question.
Yeah.
It's a common sense question. It worked before. How come it doesn't work now? And there's plenty of reasons why.
Right. Well, one, you're not a car, right? You take it in to get fixed.
Yeah.
Right. They change the muffler, and then you're annoyed that the muffler isn't working 20 years later.
Well, yeah, that's one way of putting it. But you want to use a car analogy. You come in, you fix the muffler, you drive out, the muffler sounds good, and you go halfway down the street, and then the carburetor goes or the transmission goes.
Right.
Then the car's getting older, so guess what? It's not just the muffler anymore.
Right.
You need bearings, you need spark plugs, you need maybe a motor rebuilt, you need transmission, you need air conditioner, you need an alternator, all these different things. Those you can consider like pain generators.
Yeah.
You got a car that comes in with 10 things wrong, but the obvious thing, it's got a loud muffler. You fix it and you drive out and it still doesn't drive right. Now, if somebody doesn't understand mechanics and the aging process, they get pissed off. Why is it not driving right? Well, muffler's fixed. So that's a good analogy.
Yeah.
So as you get older, these things happen. But luckily, in our generation, even the younger generation is going to be even better. But like in my generation and your generation, which is younger than me, but people are starting to get older. Even the younger generation compared to me are getting older. But the good part about it is the evolution of pain. The evolution of pain, I think, and I'm sure most people would agree with me, I don't think there's a medical profession or a medical field that has evolved so much as interventional pain has in the last 10 years. Forget about the last 20 years.
With like all the new innovations that have been made, I mean,
And
every week it's almost like something new.
Because why? We've discovered that you have multiple pain generators.
Yeah.
I guess that's a topic right now. Multiple pain generators.
Yeah.
And you got to treat each one individually. And the worst part is a patient trying to understand this. This is why I spend time trying to explain it. That's why I do these podcasts and these radio shows, to tell people and show people that you have so many different pain generators. And the older you are, the more you have, and the more work I have to do to isolate which one's giving you the pain and eliminate the pain from that pain generator.
Right.
Then what comes along with getting rid of pain generators, usually one at a time. I remember meeting a guy, a doctor, said, "Oh yeah, I gave a facet joint injection. I gave a transfemoral epidural, cervical. I gave a lumbar transfemoral epidural. I treated the arthritis. It gave me like 7 different injections. The guy did it at the same time. The patient felt fantastic, but you don't know which pain generator is the one that's actually causing the pain. Right. They don't all necessarily cause the pain. You could have 5 different pain generators, treat one, and then all the pain's gone because that's the only one that was hurt at the time. So this comes up with the subject, and I want to beat it to death.
Well, that happened to me when I first met you. We did the endoscopic discectomy on me, and it cleared me out. But you saw another herniation. You said it's smaller, and I don't think we need to do anything with that right now because it doesn't look to be affecting anything. And then later, a couple of years later, that went worse. But it's along the lines of what you're trying to say. Yeah,
it's aging and things breaking down.
Yeah,
as you get older, and you didn't have the you were a stuntman, so it wasn't like you had a leisure young life, did nothing.
Yeah,
that beat the hell out of yourself.
Yeah.
So this different pain generators comes along with patients, and I want to bring it up. Why? Because every once in a while, maybe once a month, twice a year, sometimes more than others, I get a patient that comes into my office with no patience. They want their pain to go away yesterday.
Right.
And they get mad at you. They get mad at you that you didn't get rid of the pain. Oh, well, I feel 50% better, but I still have pain. Well, guess what? It's another pain generator. You got patience. And then you get rid of that. But some of them fly the coop. Some of them go get major spine surgery because you didn't get rid of their pain with one injection.
Yeah.
It's like I got a magic wand. You can't do it. You gotta pick them off one at a time. I mean, we got pain generators.
It's a process, though. That's what they got to understand. It's not just a one and done. I mean, if you do have multiple pain generators, there's a process. You usually go with the worst first and work your way down. I mean, that's it. But the people coming in, all these brand new patients who have been going to other doctors and they're not happy with them. So by the time they get to us, they're so frustrated at everything that was done before and didn't work, and they want this done now. And and you're like, what the heck? Yeah.
I had a guy yesterday. I told him about this. I gave him a little talk about the different pain generators he has in his spine. And he's been my patient for a couple of months. And not that you do a lot in a couple of months, because you got to see him every 3 weeks. And stuff like that. And the guy's 50% better, but he's not 100%. And he asked why, and I explained it to him. And then I go on to talking to him about having patience. And if he doesn't, he kept saying, "I got patience." I said, "I just want to let you know, because I've had a couple of patients this week that didn't have patience, and they made mistakes in my opinion.
Poor decisions.
Poor decisions on, and that's my opinion.
They
might have thought they thought they made a better decision than I recommended.
Well, it's your professional opinion. That's important. Yeah,
professional, based on my experience.
Yeah,
and based on my knowledge. That my knowledge is pretty vast because of the fact that I've been doing it so long, and I see what works and what doesn't work. But the guy at the end, I explained to him, I said, about the patients and what he has to have done. The guy says, Doc, I'm not going anywhere. I got patients. I do not want major spine surgery. Even if you told me today that I could not get you any better, he goes, I'm happy. 50% better than I was already. And you say you can get me better. I'm happy even if you can't get me any better. I'm not going for major spine surgery.
Yeah.
And that's a good attitude. Not I had an experience within the last week or so that a patient I've been treating the patient for years, right?
Yeah.
And I treated the patient 3-4 years ago, and the patient did fantastically because she was younger, maybe 5 years ago, and then now she got worse, so I started treating more pain generators she didn't have 5 years ago, and she had some of what she had before. 5 years ago, but more levels. Because in the lumbar spine, you got 5 different levels. You got five discs, which get degenerative.
Yeah.
And cause all the problems. Maybe I fixed 2 of her discs and problems, and now the other ones are working. And I was telling you might not get better until I fix every one of those levels.
Yeah.
I could do one level, and I say this all the time. You got 4 bad levels. I do one, you might get. This is one extreme. You might feel great. Don't need the other ones done. That's why we do one at a time. But the people who really have a lot of patience, especially with the spinal spacers, you put the spacers in for spinal stenosis. These people, sometimes if I had a guy had 5 bad levels, he did not get any better until I did his last level. Now that's a guy who has patience.
Yeah.
Like I don't think I would have that kind of patience. It'd be like this lady was like, I've been coming to the outpatient for way too long. I'm done. And I think the quote was something like, I don't have time in my life to wait for you to get rid of my pain. I'm going to get major spine surgery to get rid of my pain once and for all. How many times have I said that?
Yeah. Yeah.
There's no such a thing as getting rid of your pain once and for all with major spine surgery.
Listen, I had major spine surgery. I had the big open back surgery, and it didn't work. It was like a Band-Aid, really.
Well, let me tell you about your back surgery.
Yeah, go ahead.
It seemed like big open back surgery.
Right.
But whoever operated on you, I'm not going to bring the names, whoever, I don't care. But whoever operated did their best they could possibly do. Whether it's a right level, wrong level, you had multiple levels. They did the least amount of damage to your back.
Yeah, that was a good thing. Yeah.
Because I had a lot to work with.
Yeah.
But when you start cutting out all these bones and then you put fusions in, you are done.
Yeah.
You are done. I mean, once they take all these bones out and they put fusion in there, there's really not much you can do. Maybe if it gets tight around the nerve from scar tissue, I could maybe do a transfemoral epidural, calm it down temporarily. But if that don't work, you can't even do the joints. You can't. There's nothing you can do, and then it destroys the levels above. Then they got to fuse that. But what they did for you, they just took a little bone out, they took out whatever ligament and maybe the herniation, whatever it was. You said it didn't work, but who knows why it didn't work?
Well, it lasted about a year for me, and then it filled up with scar tissue, and I was back to square one again.
Or you just maybe reherniated.
Maybe, maybe.
But that was a conservative doctor, and they don't do that anymore.
No,
it's very far.
I was lucky. I was lucky there. Yeah,
it's very far and few between. They just take out a little bit of the. They take a little bit out of this bone and go in there and decompress whatever needs to be decompressed. That's like a hemilaminectomy or laminotomy, not a complete laminectomy where they take all these bones out.
Yeah.
Right. Some people have real thick ligaments, but believe it or not, you do a little hemilaminectomy and take out that ligament, which is the second best thing, being an open spine surgeon, you take that ligament out, they're going to do great. Right? Not take all the bones out, because on the other side, underneath this bone here, there's nothing. There's nothing there. All right, maybe you worry about some swelling of the facet joints, but they really give you a problem if you take out all that ligament.
Yeah.
But the problem is today, and I hate to say it, but they don't pay much for that anymore.
Yeah.
It's not worth them going in there and doing a hemilaminectomy. It's a pain in the ass to go in there and do that. It's very, very tedious. It's a tedious and it's not a long operation. It's not real bloody, but it's what these guys need. Well, what they really need to do is do what I do.
Right.
Right. They don't even have to do that. But if they're going to do any kind of surgery, that's the surgery like they have with you.
Do you think it's because they fear patients suing? That they don't want to touch the or
I don't know. Well, everybody's always worried about a patient suing because most probably
they do it so
95%
easily today.
95% of the time they sue just for the money.
Yeah. Yeah.
Well,
that's what I was saying.
And the doctors do nothing wrong, so it really doesn't matter what you do. They're gonna get you anyway.
Yeah.
But the question is it worth operating on the spine for a couple $100, basically?
Mm.
A couple $100. It's most doctors feel it's not worth it. But the other aspect is it worth operating on a patient to make him feel better? Yes. But we got certain procedures that they don't pay for, so therefore they don't do them.
Right.
That's one of the problems. The insurance companies don't want to pay for it, especially the disadvantaged programs.
But just to summarize, the process is important. Sticking with the process is doubly important. Like when I get stopped in the waiting room by people who've seen me on the TV commercial and stuff, and they want to find out, I always tell them, I'm like, stick with Dr. Jasper, stick with the process. Yeah, it's not going to happen overnight, but you will get better. Your life will change for the better. So you have to stick with the process. If you don't stick with the process, yeah, you can go somewhere else and get, fusions, and you can get all this other crap. I mean, we've seen patients come in with stuff in their spines from old days, like wrenches and stuff. You just screw up your whole back.
Sheetrock screws.
Sheetrock screws. Yeah, I remember that. And they were working their way out after all these years. That was like some back alley thing somebody got in
wires. I've seen
Calcutta.
I've seen fusion with just wire, like hanger wire. That
right.
when you hang your T-shirts on or something.
Yeah. So I mean, you have to be patient and follow that process
along that subject.
Yeah,
and we're on that subject now. A common question, a person who's in denial, who just doesn't understand the process, and they never had shots. They've been suffering for years, and that's probably one of the reasons why they didn't go see a doctor, because they felt once you see them, you're never gonna have to. They're never gonna stop giving you shots, right?
Right.
And you want to start with an epidural for two reasons. Number one, they might get rid of all their pain for a long time,
right?
And at the same time, you're trying to make a diagnosis. Is that the worst level, or is that the pain generator? And then you're trying to figure all this out with a pretty crummy MRI. And the patient says, "All right, doc, you're going to give me this injection. Does that mean that I'm going to be doing this for the rest of my life?"
Right.
It's hard for me to answer that. First of all, you can't answer that question, because I've had patients I give one shot and I don't see them for 5 years.
Yeah.
Other patients, you give them, you got 5 pain generators, you got to give them 5 different shots or 5 different treatments. And by the way, somebody who has a bad back, I hate to say it, but maybe you need shots for the rest of your life. Maybe you need certain types of interventions for the rest of your life. But you should be happy that today there's something that we can do to make you live a good quality of life in between these procedures.
Right.
Otherwise, it's just torture, and you don't want to live. You can't do anything if you don't have them.
Yeah.
Lucky years ago they didn't have that. Today we have it. It's keeping the patient. You tune them up once in a while, and the people that especially ones that have been in pain for years, and you make them feel good. They're like, "Doc, I'll come as many times as you want,
right,
as I need to feel like I feel now." because of the pain generators,
Right.
And if we could do real quick. I mean, it's not even quick. You could have discogenic pain coming from the disc because of the nucleus, and we could take care of that. I'm gonna joke around a little bit and say we could fix that.
We can
You can never really fix a bad back, but
Yeah.
and just it might we could fix that.
Yeah.
Not permanently, we could fix it. Then you get pain from this bone here. It's called vertebral body, right? Which means pain from the vertebral body, vertebrogenic pain. You get multiple pains from the vertebral body. You can get a crack, which is a compressor fracture, right? You can get motor changes, which is sort of an inflammatory change coming from the discs extending into the end plate and past the end plate. That we could do by killing a nerve in a center, which is basal vertebral nerve. Right? I just named 3 different ways. And there's different ways of getting rid of discogenic pain. We used to do IDET, which is intradiscal thermal, where we killed the nerves on the inside of the disc. That nobody pays for that anymore, but it worked in its day.
Now, on that model, see, I think most people don't realize. Show them how thick the discs would be if you were young and healthy.
Well, yeah, if you're young and healthy, all the problems go away. Aren't there because look how thick this is.
Look how thick that is,
right?
Yeah.
But when it breaks down, it creates all these problems. Another thing, another pain generator. These joints here in between, right? These joints here in between become arthritic. That's spondylosis. Spondylosis, arthritis of the fat's head joints, zygohypophyseal joint. So now we talked about discogenic pain, vertebrogenic pain, spondylosis from facet pain, which is arthritis pain. Then we talk about, you see that hole when you see the hole in the middle where the nerve is?
The neuroforamina.
Right? That's the neuroforamina. Look how big it's supposed to be. When the disc breaks down, that closes up.
Yeah.
Right? When it closes up and it makes the nerve swell up, right? Look what happens. It tightens up around that nerve right there.
See,
that's called radicular pain.
When I was young and I was doing those stunts, okay, I pulled my back out a bunch of times. All right, and I was out for maybe 4 or 5 days, and then it'd feel better. But my discs were that thick, and everything was that healthy, so they healed up easier. But now that your body's lived a life, and everything you did in your life, it leaves a mark, and you're going to pay for that later, and now I'm at the point where I can't heal up anymore. I have to rely on Dr. Jasper to help me out when my back gets so bad,
Yeah. And you go through long periods of time without pain.
Oh yeah.
Or maybe not. Listen, most people don't go through life without pain.
Right.
But pain that you could tolerate and function. Yeah. Have a good quality of life.
If I go through a year without pain, and then all of a sudden I feel my arthritis in my spine acting up, so I come in for a tune-up, you can't put a price on that. Yeah.
And people like, you mean you got to give me more shots? You mean I got to come back here?
It's a process.
Are you trying to make money? You got to pay off a car payment or something? I want to punch him right in the face when I say that.
That's like an old stigma that people have about doctors, that they're just in it for the money and all of that. And that's not the case. If you actually take the time and get to know your doctor, especially Dr. Jasper here, okay, he'll get to know you, and you'll realize this guy's got your better well-being in mind.
I got you. I got your back.
He's got your back. Yeah.
That used to be our motto. So let's go through it again. The last one I talked about was the pain coming from a pinched nerve. That's commonly known as sciatica pain, radicular pain. That this nerve, or it could be multiple nerves on both sides or one side, shooting down. And these are the nerves that create the sciatica nerve.
So
they all blend into the sciatica nerve.
The pain going down your leg, that's where it's coming from.
Yeah. It shoots down your leg. And depending on what level, we can make a different diagnosis. If it's a 2-3, it's usually groin, hip area. A 3-4 goes down from the groin, hip into the up to the knee, not past the knee. And a 4-5 goes to the calf. and past 5 can go all the way down into the foot.
Yeah.
So we pick it out. We look at the MRI, and I treat that, right? So every time I tell you a new pain generator, I'm going back and going over it again so people understand.
Yeah.
We talked about discogenic pain, vertebrogenic pain, talked about facet pain, arthritis pain, now sciatica type pain, right? Now, there is pain that you get from spinal stenosis.
Mm.
And by the way, it's all caused, and I keep saying it because you need to understand this. It's all caused by this disc going from here to there.
Yeah.
And you got spinal stenosis pain that goes away when you sit down because this opens up, and it comes back when you stand up. When you lean on a shopping cart, goes away. You lean on a counter, goes away. You stand up, this collapses. That's why when we put those spacers in, it works. And what causes it? The main reason, not the only reason, and the easiest way to treat it is through the ligament that you find in here. So it's caused, they get what they call intermittent neurogenic claudication, which means that you walk a certain distance, you got to sit down. You stand up a certain time, you got to sit down.
Yeah.
Right. That's where you have so that's another one. I don't know. Are you counting?
Yeah. No,
Yeah,
I know.
Count. Discogenic pain,
1,
vertebrogenic pain,
2,
arthritic pain
3,
in the facet joints, sciatica pain,
4,
and you get central canal stenosis pain.
5.
That's 5.
Yeah.
Right. I usually say you got about 5. Can you think of any more that comes from the spine? I'm sure there's more.
Yeah, there is more. I do have a great analogy for the people. If you take your finger, all right, and then wrap your fist around it lightly to start with, just lightly, okay? Now, imagine over the years it gets tighter and tighter and tighter because your discs are getting smaller and smaller and smaller. Now you can feel the pressure around that finger. Okay. And all of that is what's happening in your back through that neural foramina and all that. You can feel it, how over the years it gets tighter and tighter and tighter. Things are going to happen. That's just nature. Yeah.
That all of these pains create almost the same type of pain. There are some minor differences how we make a diagnosis.
Yeah.
Right. And by the way, we didn't talk, not even talking about the spine, but you can get sacroiliac pain, which I don't have a model here from the sacrum, because what you have is this is the spinal column, which connects to the sacrum, like the tailbone, and that connects to your hips. And where you have the iliac crest, which is part of the hip bone, the pelvis, connects to the sacrum, you can get sacroiliac pain. Anyway.
Oh, and bone spurs.
Well, bone spurs, what are bone spurs? I mean, we could talk forever on what causes spinal stenosis, what causes pinching of the nerve coming out, what causes the arthritis. I mean, the bone spurs, of course, herniations. We didn't talk about herniations, but what are herniations is they pinch the nerves.
Yeah.
Right. And then when you got a crack in a disc like that, that causes discogenic pain.
Yeah. Yeah.
But just to talk about some of the symptoms, they all cause generalized back pain. But we got to distinguish between, obviously, when you got a pinched nerve, it causes a sciatica pain. That's classical. And when is it worse? Most people, which this isn't engraved in stone because sometimes they trick you,
right?
These pain generators. Most of the time, it's when you sit down. These are the pains that you have shooting down your leg or into the buttocks, where you're driving your car for like an hour, half hour, 2 hours, and you're changing positions. You're stretching your leg out. Maybe you got to get outside the car and walk around.
I remember that myself. The pain was right in my buttocks, right behind there, and you're shifting to try to ease it up.
You stick your leg out.
There's no easing it up.
Put your leg up on the dashboard.
Yeah,
and I see people with the legs on the dashboard.
Oh yeah,
like what the hell are they doing that?
Oh
for?
Yeah,
right. That's classical.
Yeah,
for a pinched nerve. Another thing is, classical for spinal stenosis is that walking and then having to sit down.
Right.
That's classical. Right away, people come in, they don't have MRIs. I say, you got spinal stenosis when they start to explain. They don't have stairs in the house. They know how many stairs they have. They pull themselves up the banister. They lean on the shopping cart. Now, discogenic pain may cause low back pain when you stand, may cause it in any position. However, classical is when you when I walk into the patient's examining room and they're standing up. I said, sit down, have a seat. Oh, doc, it hurts worse when I sit down. Then you start to think about discogenic pain. Or you start to think about pain from the vertebrogenic pain. Because most of the time, those pains are from sitting down too long, pain when you sit down, or when you bend over and lift something.
Right.
They're generalized pain. But if that's what they, after you get rid of, let's say the what do you call it, pain, the spinal stenosis pain, you get rid of it, and all of a sudden they say, I could walk now, but when I sit down, it hurts. Then you start to treat that. And I can tell you how to treat you put a new allograft in there. But I mean,
that's like next level stuff now.
This is all where I say you got to have patience. If you don't have patience, you're never going to get pain free.
Yeah.
And sometimes I get to the point where I had a guy yesterday who I get rid of the majority of their pain. I mean, their pain score was 10 when they came in like 4 months ago.
Right.
And we did the mild procedure on them. We did the spacers. We got rid of the sciatica pain, but they had this aching pain that when they sit down and they have degenerative disc disease. And the guy was like, I'm 80% better, but 90% better, but I got that pain every day. And I said, well, we could probably get rid of the pain. He goes, well, you know what, doc, I'm good.
Yeah.
I'm good. I said, all right. He said, but what is it? How can you get rid of it? And I tell him about the Viadisc, the replacing the nucleus with an allograft. And I go through the scenario. He goes, you know what? That's good to know.
Yeah.
I'll wait a month and see if it's still bothering me. I'll come back if you think you can get rid of it. I said, I can't guarantee it, but there's a good chance you can get rid of it. And that's the a person who has that. Another thing is how we can isolate. Talk about symptoms. People who get up in the morning and they got pain and they say they walk around. And when they walk around, it starts to loosen up. That's arthritis. Those are the facet joints.
That's what, I got
These are the people that sit down and it's a little, it opens up a little bit or lean forward or go to bed and lay down. After they sit down for an hour and a half, whatever, like playing cards or just not getting up, and they get up and these joints, boom, they go right down. They start to rub. That hurts.
Yeah.
So now we've isolated the pain generator, which is arthritis.
Yeah. If you're rolling out of bed and you got some pain, just oof, and you're stretching your back
arthritis.
out. That's arthritis. That's
also another sign when people, you might have to make a differential diagnosis on this.
Yeah.
Whether it's discogenic pain or pain from the facet joint. Most of the time it's a combination. But when a guy or a lady, when a guy's leaning forward to shave, right, they're leaning forward. When a woman's leaning forward, put makeup on, they say that's when I get my worst pain. That could be from discogenic pain by leaning forward. Remember I told you leaning forward?
Yeah.
Or it could be the facet joints that when you lean forward, automatically your body leans forward. Now, what does the body do? The muscles in your back try to compensate for it so you don't fall.
Right.
So they tighten up to get that balance. And when they tighten up, they crush those joints right into each other. And now you got these joints with the muscles tight while you're leaning forward and shaving or putting makeup on, it starts to hurt.
Right.
Because now you got these joints that are arthritic and they hurt. I don't know. I think this is a pretty good topic today because patients are really understanding, and not only the patients. If there's any doctor out there that does what I do, a pain doctor that kind of has trouble explaining it to patients, they can review this video. They can review this video and say, you know what, that's a good way of explaining it to patients.
Yeah. I mean, because in just that little model there, you've shown like a dozen different ways of where your pain might be caused and
how you can get rid of it.
Yeah. There's a plan. There's a plan though. With any kind of pain you've got, if you didn't get any of that massive open back surgery, there is always a plan to get you better. You just got to find the right doc.
I mean, listen, when you have massive, as you stated, massive open heart surgery, you're not totally done. There's things you can do, and
open back
surgery,
Yeah.
but there's things you can do, but it's limited.
Yeah.
Like a lot of these patients come in who already have spinal cord stimulators because it almost gives you the license to put one in.
Right.
When you have bad failed, they call it failed back surgery, failed back syndrome is a code for it, which is a red flag right there. If they got a code for back surgery failure, that means there's a lot of them.
Yeah.
There's a code for it, right? There's no code for, gallbladder failure surgery. Most of the time because you don't have a gallbladder, which
right. Yeah.
But and I don't even think there's a code for someone who has open heart surgery. If they have to go back in it, it says open heart surgery failure.
Right.
It's one of the few codes that came out based on the fact that there's high incidence of open back surgeries. Think about that. Think about that. Somebody's got to think about that, which they don't know that there's a code saying that it's a diagnosis.
So, do you think there'll ever come a day where the techniques and the procedures are so good that the failed back surgery syndrome will be removed because there's no need, because all these procedures are going to work?
No, I don't think so, because a lot of these codes that patients come into my office and they say, Doc, I've been diagnosed with failed back surgery. And you look at the spine, you look at the surgeries, and I'm talking someone who really needed the surgery, someone whose back was I look at the history and the back was unstable, was moving.
Right.
If it moves, you gotta, and it's symptomatic, you gotta treat it. And the only way to treat it is doing major spine surgery and fusion. So I'm not totally against fusion.
Right.
And I joke around, refuse to fuse.
Yeah.
I only say refuse to fuse when you don't need to be fused.
Right.
I just made that sentence longer.
Yeah, that's cool though.
But the fact is, when you have failed back syndrome, it could be another pain generator that has nothing to do with the back surgery, right? Like, for example, adjacent disc disease could do it, above or below where you had the surgery, which is usually primarily caused by the fact that you had surgery there, and it fixes those levels, and the other levels, because of the constant mobility, and they take the fulcrum of all the weight on the body, they go, right?
Yeah.
But when you got a bad back, you got a bad back. Eventually, they're all going to go.
Yeah.
If you live long enough, So some people, like my father, he really didn't have a bad back. He didn't have pain from his back except when he broke his back. But hopefully, genetically, my back is okay. My neck is a little screwed up because of my, what do you call it? My extracurricular activities.
Your extreme
sports.
Sports
that I like to do, which I'm still contemplating doing, but against my best judgment. Like buying a brand new dirt bike and crashing through the woods in between trees and stuff.
Is that what you want to do?
I love that.
Yeah.
And I think I was born. Of course, everybody thinks they are, but I think I was born with a natural ability to go through the woods and with the peripheral vision and weaving out of the trees faster than the average person.
Oh yeah.
I was always very competitive with that.
Yeah.
Whereas like on a motocross track where you're jumping, triples and tabletops, as they call it, I wasn't as good at doing that. Right. Why wasn't I as good as doing that? Probably because they didn't invent those until I was already well into my 40s.
Right.
Right. And when you're into your 40s, they say that I'm still crazy at my age. And when I was in 40s, I was probably still crazy, but I guess not crazy enough to say, you know what, I'm going to fly 50 feet in the air and land perfectly on this other side of this, because the tabletop goes up, flat, and down.
Right.
You got to hit. You got to go up and land perfect. I mean, if you practice, you go halfway, then you land. But if you overshoot it,
right,
it's like somebody just dropped you out of a helicopter from 100 feet.
Oh wow!
It ain't gonna be fun.
Yeah.
You're gonna get messed up. Then you go through Evel Knievel hospitalizations and stuff.
I used to work with, back in the stunt days, I worked with a lot of these guys, stunt stunt motorcycle, stunt dirt bike guys, and they'd be doing all kinds of tricks and stuff, and hanging out with them and hearing their stories was awesome. Yeah.
But going through the woods, I've been doing that since I was a little kid.
Yeah.
So you develop you're going down into ditches, you're coming out of streams, along streams, over, edge of a mountain, stuff like that. I mean, that's fun. That's a lot of fun. But with my neck, I'm saying to myself, one token, I want to do that. And the other side, I'm saying to myself, hopefully I live another 25, 30 years. I mean, it's messed up now. How's it going to be 20 years from now? And it ain't going to make it any better by charging through the woods.
Right.
So it's like having a tire that's almost bald, right?
Yeah.
What are you going to do? You're going to start burning rubber with it?
Right.
No, you're going to milk it a little bit as long as you can.
As long as you possibly can.
How's that scenario?
We got Felix. He said he gave us a little smile. If I can find it. Oh, it's right here. Yeah, little smile. Morning, Felix.
Hello there, Felix. I'll see you tomorrow.
Oh yeah, what are you doing tomorrow?
Well, it's not a happy thing. My cousin's son.
Oh, that's right. That's right.
Had an accident, and he's donating the gifts of life.
Oh, that's brilliant.
He hit his head and he passed on, and we're going to the funeral. It's terrible. It's hard to even talk about.
Yeah. Don't worry. I forgot about that.
But anyway, talk about this thing here. Was there any particular topic you want to talk about, Jeremy? I like your input.
Yeah, my input. I was just liking the, like we describe the with the model and everything, and I just want people to realize that with all these things we're talking about on this show, this is why we have this show. You have to realize that there is that process. All right. It's important before you even pick up the phone and call. You have to understand that there's a process that needs to be followed to fix your back, and everyone's back is different. So it's going to be a different process for everybody. And I know that. I waited in the same waiting rooms that you did. Okay. And I talked with the same people, and I'm scratching my head while this guy's pain that sounds like mine, but he's feeling better now and I'm not. I get all that, but it's a process, and you have to trust your doctor. And honestly, I've been to them all around here in the area. The only guy I have ever trusted with everything is Dr. Jasper.
Well, thank you.
No, really, because the minute I met him, you could tell there's something different about the guy. He's really stand up, and he's the best. He's the best in the business. Come to Dr. Jasper. Follow that process. Have patience. And I know it's hard to. When you're suffering pain as badly as you are, patience is the last thing you want to think about. You want to lash out at people. You want to be just rageful for the pain that you've been suffering for all this time. Just understand that there's a process, and it needs to be followed if you're ever going to get out of the nightmare you're living in now.
It reminded me of yesterday. I had a new patient come into the office. Had an MRI, I don't know, 6-7 years ago. Wasn't even in the office. Never had any injections.
Yeah.
Never had any treatment to the spine. He appears to have probably spinal stenosis because of the claudication. He can't walk far without sitting down. Mm-hmm. But then he's got pain shooting down his leg. Then he's got pain in his thoracic area. He might even, and he fell, so he might have broken my back and stuff like that. And the guy's obviously in pain.
Yeah.
But he's been in pain for a long time. And I think something recently, the last few weeks, came up, and we made an appointment. He called day before I saw him, and he came right in. Mm. And of course, the nurse gives me a full report saying that, Doc, first thing I want to tell you, we got no MRI, we got no objective diagnostic studies, and that's it, right? And the guy, I think, is on pain medication from some other pain doctor or some other doctor. I don't know who gave it to him, but I go through the whole. I don't want to just say, all right, nice to meet you. Go get the MRI and come back. I want to get to know the patient. I want to feel him out. And I want them to build up some confidence in me and get to you have a little colloquial with him, right?
Right, right. Felix, so what's for lunch?
On tomorrow?
I guess so.
Never miss a comic or today. Why, you down here? Anyway.
Yeah, you down here, Felix?
Got to be more specific.
Yeah.
What lunch, what day? Whatever it's going to be good.
Yeah, yeah, yeah.
So this guy, I was with him for about, and the nurses like it because no MRI, so we can't do anything, and we can't explain anything to him or her. So it's going to be quick. We're going to make up time here now. But you don't want to just like, hey, all right, I'll get in MRI, come back. Because some of them get pissed off, right?
Yeah.
So I spent a little time. Then he started asking questions about what it possibly, because I explained to him it could be this, could be that. But I don't know. I need to have the MRI. I said, I can look into your spine. I can see, and I'll go over it with you. I got the monitor here, the big monitor. I go over everything with you. And before we do anything, you're going to understand how I'm going to fix you or make you feel better. Right. And after all of that, the guy says to me, he goes, that's it? And then we're with a half hour of a complete waste of time, except to get to know the patient and build up some confidence. And he goes, I said, what do you mean, is that it? I don't understand. What do you mean, is that it? Well, you're not going to do anything for me today? Sometimes I got to really control my temper.
Wheel me in the back and get to work.
I really got to control myself. I'm like, so I said to the guy, I was like, so you want me to do something for you today?
Right.
He goes, yeah, I got so much pain. You got to do something for me today. And I'm like, okay, I'll tell you what. Make some suggestions. What would you like me to do for you today? What would you like me to do?
Maria says she'll see you tomorrow too. And Felix says, it's a good day for pasta fagioli.
All right. We'll start cooking. I'll be there in about, I don't know, an hour and a half. And the guy was like, what do you mean? You're the doctor. Now, right off the bat, I want to throw the guy out.
Right.
Like, no gratitude, as Don would say. If you don't change your attitude to gratitude, I'm going to change you from longitude to latitude.
That's fantastic.
That was a Don thing.
That's a Don. Good job.
If you don't change your attitude to gratitude, I'm going to send you down to latitude to longitude.
That's good.
I mean, some of these people, and I said to, and so I try to pull out my nice, like I make believe I took nice pills in the morning,
right?
Which I never do.
Yeah,
I probably should. And I said, and I went through the same thing. I said, listen, I'm not poking and hoping here. I'm not going to give you an injection. Where am I going to give you the injection? I don't know what's wrong with you. You give an injection to somebody when you don't see what the MRI looks like, you could hurt somebody.
Yeah.
I said, I didn't say this to the guy because I didn't think he was looking for narcotics. He already got them at home. Right. I said, if you have any suggestions, I got no guidance here, 25 years ago, you came in like that. I might give you injection here, injection there. It was just a shotgun approach to things that might take the edge off. But I don't do that today because what's happening is you don't want to bombard you with too much steroid injections. Right. So, chances are it's not going to work based on what your clinical history is. So please, do yourself a favor.
Yeah.
Get yourself. I said, listen, if you call on the way home an MRI place, I think this was Wednesday. Yes, it was Wednesday. If you call for an MRI and you get in this afternoon or tomorrow morning, I'll see you Friday.
Right.
And we'll come up with a plan. Maybe I'll do something for you Friday.
Yeah.
But it's up to you to act now and get that MRI. Right?
Yeah.
So that's another topic there. Pasta fagioli. Yeah, we used to save we have the prosciuttos. Of course, today they sell you the prosciuttos with no bones. But we used to have the prosciuttos in Italy, and we used to debone them ourselves. And take the big femur bone out, all the bones out, right? And then we wrap the prosciutto, slice it, but we take the bone and some of the scraps.
Yeah.
And we make a pasta fagioli out of it.
That's great.
A pasta fagioli.
Pasta fagioli.
And that came out good. But yeah, he makes it. Felix makes one of the best pasta fagiolis I've ever tasted.
Yeah, Felix is a great cook.
Yeah. Anyway,
and he loves it.
Today I got you see my nose, how red my nose is?
Yeah.
See how red my nose is? Today I'm going to go to a dermatologist.
Oh.
And you're going to do some laser surgery. So people stop calling me Rudolph the Red-Nosed Reindeer. Calm it down a little bit, you know.
Yeah.
It's starting to bother me. It gets irritated. It gets real bad in the sun.
Yeah.
So that's what I'm going to do today. It's 11:30, so we're going to get out of here a little bit earlier. What time is it?
Yeah, we can.
We got a couple more minutes. I want to leave about
more
5
minutes.
minutes to 11.
That's fine.
Might be traffic and stuff like that.
Yeah.
So, like I said, anybody have any questions? We got.
If anybody has any questions for Dr. Gabriel Jasper, please ask now while he's still in the studio. We got time for one good question. You
could even put the question right on the screen, right?
Yeah, I can put it on the screen as soon as.
If they text it somehow.
Yeah, they'll text it. Here we go.
But hey, like my shirt here, I wear this all the time.
No.
This way I don't forget the instruments when I'm flying an airplane.
Yeah, that's great.
All right, so you know what? No questions.
No answers.
So we're gonna finish off by telling them where we are.
Yeah, we're at 35.
35,
isn't it? 37 Brick Boulevard, building number 3.
Did you have a brain fart or something?
I do at times.
It's all right. Listen, I don't mean to put you on the spot like that.
It's fine.
It's 74 Brick Boulevard.
Oh, it's 74 Brick. That's my dyslexia. I got dyslexia, so the numbers
Brick Boulevard.
change
all right.
around.
This way people remember.
Yeah, 74.
Hope they don't knock on the door at
35
at 34 Brick Boulevard. I think that's what do you call it? I don't know. I can't think of something fat.
Yeah. Liposuctionist.
Yeah, you walk in there, they do testicular transplants.
But Doc, I thought it was my back.
74 Brick Boulevard.
Yeah.
You call us at 732-262-0700.
Yeah.
You could fax us your MRI report, and I'll go over it.
That's 732-262-0400 for faxes. Yeah. But the number's on the screen right now, 732-262-0700.
What's Dr. Jasper MD? Is that what it is?
Yeah, it's right up on the screen now. JasperMD.com is where you find out everything you want to know about Dr. Gabriel Jasper and all the wonderful things we talk about on our show.
And if you missed the show, you can go on YouTube, Spotify,
everywhere,
Facebook.
Everywhere podcasts are found. Just type in Painless with Dr. Gabriel Jasper. It'll come up and they'll be all archived. You can listen to them all.
I mean, if you want to call the office and ask questions, you're welcome. The front desk people could ask probably could answer 99% of the questions.
They love doing that.
If not, we get a nurse on the phone. If they can't answer it, I'll talk to you personally.
Yeah.
Right. All right. Thank you very much. Have a great weekend. It's a lovely, lovely, windy, rainy weekend. Hopefully tomorrow will be better.
I hope so.
Monday, starting next week, it'll be better.